Okay, so I'm the owner of Picture of Health Thermograms. My name is Jill Merrill, and I opened this business in 2011. I was an air traffic controller. I used to get paid to tell people where to go and what to do. I enjoyed that job quite a bit, but I retired from that in 2011. So I really didn't intend to do anything else, but as things happen in life, I ended up opening up this business because of personal situation in my life. 16 years ago, my mother had breast cancer and went through breast cancer treatment, and I was with her through that journey. And it really scared me. It was something I didn't want to have to deal with myself. So my friends took me to have a thermal image done of my breast and to help figure out part of the prevention portion of breast cancer. And I found that I had a little something cooking there, and it scared the daylights out of me. So I talked with the doctor. We drove to Mooresville, by the way, which is north of Charlotte, 3 hours and 15 minutes one way. And I talked with the doctor there. I said, what can I do? I don't want to go through what my mother went through. And he talked to me about what I ate, and I ate all the crap that most people eat, and found that that was a problem. So I worked on my diet, I worked on my health for about 1.5 years, and turned that around. So, and one of the things you learn in the presentation is that it takes about 8 to 10 years for breast cancer to actually develop from the cancer cell to the tumor. So I was able to change that outcome for myself. When I retired, I wanted to bring that to the Fayetteville area so people didn't have to drive 3 hours and 15 minutes one way to get the test themselves. So anyway, that's a little bit of background about why I opened the business, and I'll tell you a little bit about digital imaging, thermal imaging. So breast cancer statistics, they've actually, there's more prevalent since I did this slide a while back. And Cumberland County, if you don't know, it has the highest rate of breast cancer in the state. So it's really an issue here. And again, there's not a lot of tools. I mean, everybody knows about the mammogram and those kinds of things. There's not a lot of tools out there. So this is an additional tool that we can use, is the thermal imaging. So the deadliest breast cancer is called inflammatory breast cancer, or IBC, and that is prevalent in women under 40. So I know we have a lot of men here that most don't have to worry about breast cancer, but I bet you're married, or you have daughters, you have women in your lives. So it's just as important for you to be educated on this as well. But anyway, breast cancer in women under 40 is the deadliest. It can kill a woman in 2 years. So that's why everybody freaks out when they say, oh, she was only 22 and she had breast cancer. So it's a different type of cancer, and we'll talk about this a little bit here. So the survival rate is much lower when it's a quicker process. The other thing is there's oftentimes no symptoms in IBC. So you don't know about it until it's too late, and it's too late to do anything. A mammogram will not show inflammatory breast cancer as well. So again, it's anywhere from 6 to 8 and sometimes up to 10 years before it can be, a lump can be seen, or a tumor is actually seen on a mammogram or felt. So you have some time to work with it if you can find it early. So this chart talks about how the cancer cell doubles over time. So again, it goes a little bit faster if you're younger. So under 50 in 80 days. If you're over 50 to 70, it's 157 days. Over 70, it's 188 days. So as you get older, time is a little bit more on your side. So of course, you've heard there's a lot of controversy over when to get mammograms, if you should get mammograms. And the reason being is that dense breast, which is more prevalent in younger women, they're just thicker and they're harder to see through. They're also more susceptible to radiation issues. So you don't want to start nuking the breast at a young age and continue to do it often, because then you end up causing what you're trying to prevent. So there's a lot of controversy on when and how often and so forth. So they have raised the age where they recommend doing mammograms. So again, here's some of the mammography in young women. They usually tend to have denser breasts, and they can't see the issues in the breast as well. Excuse me. So this is just talking about the breast density. And then these are the pictures. As you can see, it just gets very cloudy. Excuse me, the more dense it is. And of course, the more dense it is, they can't see it. Excuse me. So limitations of mammography. Very uncomfortable. It doesn't detect all of the cancers. Again, if you have dense breasts, it can cause more issues than it helps. So what alternatives are there? This isn't considered an alternative ultrasound. I've never actually seen this method myself, but anyway, it is out there. Molecular breast imaging is available as well. I'm not sure how much radiation is, how much radiation there is with this particular method, but that might be something to look into. So clinical thermography is a simple test. It uses no radiation, no pain, no touch, no contact. It's a test of physiology and function. So the differences between a mammography and sonogram compared to thermography is mammography and sonograms show you what's here now, and a thermogram shows you what's coming 8 to 10 years in advance. So it gives you that option of preventative if you choose that to help change the outcome. You can also do a full body thermogram, which will show up to 70 different things in the body, but the number one use is in early breast cancer detection and prevention. So digital infrared thermal imaging, or DITI, again, is talking about, it's very sensitive. It can show lots of different things in the body, as well as the early breast issues. History of thermography in different form. It was actually used as early as 400 BCs by Hippocrates, using mud on the body. So 1982 was certified by the FDA as an adjunct tool in breast cancer screenings. Angiogenesis is the blood supply to the cell that turns the cell into a tumor. That is the main thing that's prevalent in the thermal imaging. Okay, all right, so it's proven technology, 97% effective in detecting benign versus malignant breast abnormalities. I can't talk today, so anyway, if it's used with a multimodal approach, it's even more effective. So basically, all women can benefit, and I've actually done some of these on men as well. At Paris Island and a couple other bases, there's a high incidence of male breast cancer, and that's probably from the water. The water was contaminated down there. And there's no other test to show breast cancer on males. And when they get it, it's usually deadly because there's usually not any symptoms until late in the game, and they don't have any testing other than the thermal imaging. So the procedure is pretty simple. Just robe from the waist up, acclimate to the room temperature, complete some paperwork. We do the imaging, and then the client gets to review the images. They're sent off to a thermologist who is a medical doctor trained to read the thermal imaging. So I'm the technician, I'm the thermographer. These get sent off to a thermologist, and he's an MD, or she is an MD that's trained in this. So it's safe, non-invasive, no radiation, establishes a baseline for early detection. This is a normal breast study. And then again, inflammatory breast cancer, which we talked just a little bit about. You don't have to have a lump to have breast cancer. So these are some of the symptoms that may be shown in inflammatory breast cancer, but there are several women, most women don't have any symptoms whatsoever. And again, excuse me, this is prevalent in women under 40. So this is the signature of inflammatory breast cancer, which is totally different than the DCIS. This is DCIS, which is ductal carcinoma, which is the typical breast cancer that you see. So you can see this is the area, the blood supply that surrounds the tumor. And if there's lymphatic involvement, you'll see that as well. Excuse me. So that's the image from the side. This is early stage. And this is male breast cancer. You can actually see that this has full lymphatic involvement going around here. So it has the same exact signature, because this is the DCIS. Excuse me. So here's a case study. You can see on the left breast that there's some inflammation there, and and then it was confirmed by mammogram and fine needle biopsy. And then decisions were made to consolidate the tumor before or to reduce the tumor before surgery. That was the patient's choice, along with the doctor. So they used thermal imaging to monitor how well that process was going. A lot of women come for that as well. They want to see how. See if the tumors are really reducing without exposing themselves to more radiation. So this was the after the last chemotherapy. You can see it's quite reduced. So thermography detects changes in physiology over time. Another issue with women is a lot of them have fibrocystic breasts, which are always tender and painful, or often tender and painful. And so it causes a lot of unnecessary testing. But with the thermal imaging, you can watch that over time. And if it doesn't change over time, then you know that there's nothing cooking. So another option is, and this is before and after. This is a more natural approach, which is what I did. I changed my diet, my lifestyle, reduced stress. There were a lot of components in there. I started exercising. I lost weight. Completely revamped my my food, how I was eating, and so forth. And this is what happened. So it really shows that the food is a key thing in disease in your life. So, and again, this is why, why I opened this business, was because of what happened to me. And I've had many success stories over the last few years that have gone through the similar situation. So these are the 70 other things that can also be seen on thermal imaging. Some of them really can't be seen any other way. For example, whiplash. There's really no way, you can't show that on X-ray. So, but you can on thermal imaging. You can also look at the treatment program. How is that working? I have some different handouts over here and some things to look at that will show you some more information on that. So, I want people to know their options and know that this is out here. So part of the process is education, of course. There's been some issues with insurance. They cover it, they don't cover it, they cover it, they don't cover it. Sometimes they cover it. That's where we're at now. Is, one person with one company can send it in, another person with the same company will send it in, and they don't. One gets covered and one doesn't. So I don't know. There's no rhyme or reason right now, but the price is very reasonable. So my biggest challenge is I've taken the business to the to the length that I can by myself. And so I'm really looking for a business partner, someone to help take it to the next level. I need someone in the community, someone that understands marketing and business, has that type of background, that's interested in this kind of stuff. Maybe even someone who's already established in business would like to add the services. They already have an existing flourishing business. And that's my point right now. My issue right now is I want to take it to the next step, and I need some help doing that. So, and I'd be glad to answer any questions.
You mentioned diet modifications. What type of modifications did you make? Did you eat more plant-based or?
Well, the simplest way to answer that question without, spending a lot of time is that if you eat very basic foods, not processed, not treated with hormones and antibiotics, just a very clean diet. I do eat mostly plant-based, maybe 70% plant-based, and then I eat a clean or a lean and clean protein. So no hormones, no antibiotics, free range, those kinds of things. So that was the big change. I don't eat out at fast food restaurants.
So you continue to eat protein, meat?
Oh yes, I do, but I eat clean meat. I cut out the sodas. That was probably the hardest thing for me. I don't know how my kidneys function, to be honest with you. I got up in the morning, I drank coffee till noon, then I had my Coke or Diet Coke, and then at night I had a glass of, with dinner I had either a glass of water or a glass of wine. I never drank water, so that was another thing, was I cut out all that sugar and drank water.
So do you continue the coffee and the wine, or have you given that up as well?
In moderation.
In moderation.
I have a little bit of coffee in the morning, and once in a while I have some wine in the evening. But in the meantime, I'm drinking water, clean filtered water during the day, and no sodas.
How have you marketed this to the medical community?
Well, it's been an interesting transition. When I first got into it, I actually tried to get a couple friends of mine that were doctors to bring it to their practice. But they were like, I don't really know what this is. We think it's great. You start the business and we'll send you referrals. And then, and they have done that. And I actually have gone to some of the doctors' offices and do these as well.
Right.
But, and it's been interesting with the other doctors that I don't see. They would tell their patients initially, early on, they would say, well, I don't know about this. I think you wasted your money. Now, these same doctors, 4.5 years later, are telling them, it's been a while since you had that thermogram thing. Don't you need to go and do that? So this is the transition. And I've had a lot of phone calls in the meantime. A lot of chiropractors, also refer. So it's been a learning experience for them as well.
Yeah, for a diagnostic tool, I can see where this would be beneficial to a primary care or, secondary care physician. So my question is it been by word of mouth? Have you done presentations? I assume that this is kind of like a franchise process. No, you just did this.
No, it's not.
All right. What backup has been done in, with professional journals and stuff like that?
Well, it's been, studied over and over again. The one drawback is there's no funding from Big Pharma. So it comes from other areas. The doctors get their training at Duke University.
Right.
So it's used more in other states than North Carolina. We're always a little bit behind the power curve to get things like this going. But it is here and, gaining popularity. I have people that come from Wilmington and Myrtle Beach, South Carolina for, their testing. It also has industrial applications. Somebody faking an injury, thermal imaging can show. They use it in sports. They've used it for horses for 30 years or more.
Yeah, that's where I know it from.
Yeah, okay.
My question is, they have professional associations that have meetings and stuff like that.
Right.
Have you reached out to them to do presentations?
No, what are you talking about as far as?
Well, local.
Oh, local,
Yeah.
A little bit. Not, again, I'm one person, and that's the issue that I have now. I can handle my client base, but I can't do a whole lot of extra stuff like I could in the beginning, because I had less clients. I could go out and do all these different things.
Okay.
So, but I do lunch and learns, and I do belong to some of the local medical groups, and I do those as well. I go into doctors' offices and do the lunch and learns.
How does thermal imaging compare with the new 3D mammograms that they're offering today?
Well, again, according to the FDA, it's a different type of test. A mammogram shows you what's here now, so that would tell you if you already, for example, let's say a woman went in and the thermal imaging shows something, and the doctor says, let's go and do a mammogram, so we can get a different type of test to
What
look
about
at
the
it.
3D mammograms?
They're different. They're different type of tests. You can't say that they're the same. It's like comparing apples and oranges. They're both fruit, but they're different types of fruits, and they have different nutrients and different so forth. So with the thermal imaging, there's no radiation. You know, with the 3D, there is more radiation than with the regular ones. So there's, you know, pros and cons to, you know, to that.
What is the cost relative to the mammogram? Dollars? and
Well,
cents?
the thermal imaging, I've tried to really hard to keep the prices very low in this area because I want it to be available to everybody. So to come in for the first time for the breast thermograms, it's $170. And there is a schedule. You do one in 3 months. That's the baseline for the rest of your life. Every thermal imaging after that is compared to those first two. So and then you do them annually. So when you come back in, I give you a $30 discount. It's $140, you know, at that 3 month and then annually. If you stay on schedule, if you are a month late, then it goes back up to $170. So a little incentive to come in on time. Every other type of thermal imaging, there's no set schedule.
So is this an annual thing?
Yes, and
It's
it's an international thing. I have military that go to Germany or someplace and say, well, I want to continue doing this. And I don't want to come all the way back to North Carolina, so I find somebody for them there or in another state. So it is an international database.
Thank you.
What percentage of your patients are cash patients versus private, and is it covered at all by?
Well, first off, I'm not a provider, so I cannot take insurance.
Okay.
It depends on the person's insurance, how it works. Now, if they, I have some people with Blue Cross Blue Shield, they get a referral from their medical doctor, and so I print out a statement, and then they file that, and they get reimbursed.
Okay.
So that's how that works at this current time.
So you wouldn't know how many of them are covered by insurance versus cash
I
pay?
can tell you it's not a lot.
Okay.
Aflac, I know, does pay something towards it. I think it's like $100 a year or something like that. And Blue Cross Blue Shield's been hit or miss. The HSA or FSA accounts, the health savings accounts, most of the time those pay for it. I know PwC had a problem. There was somebody with PwC about a year ago. They had a problem with it, but the year before it paid. So I don't, you know, things change every year as far as what they're going to cover and what they're not going to cover. So it's kind of hit or miss. Like I say, I have to really try to keep the prices low and affordable. When you look at a yearly, you know, it's not that much over the year.
Right. I was just curious because I think when you look at the marketing and sales aspect of it, the first question your client is going to, or the patient's going to ask is it covered by insurance? And you have an easier sell if you can answer that very quickly. Yes, if the provider, you know, can assure that knowing whatever the history is or knowing what notes need to be written in order for the insurance to approve it.
Yeah.
If you get that lined up, I feel like the sales and marketing would flow a little bit better for you. For the company.
It is what it is. So it's just one of those, it's basically out of pocket for the most part.
Right.
But again, you know, I try and keep the prices down so it's affordable. And a lot of people buy gift certificates. I go out sometimes and there's all men in the room, and you know, I usually don't go to present to all men, but that happens sometimes. So they get gift certificates for their wives and their daughters.
Right.
So because they care too. Did you?
Being in the medical field, a lot of these imaging, even MRIs and things like that would go towards your deductible, and usually that's a higher amount, $1,000 deductible that you have to pay out of pocket before your copay. Office visit usually is your doctors. Usually you have a copay. For procedures, you usually have a deductible, which is significantly more than you have to pay out of pocket before your insurance kicks in too.
Yeah.
Have you considered looking into having like interns to help you with the marketing piece that you're unable to do right now?
I have looked at it a little bit. I haven't, but it is something to explore. What I would really like to do though is find a business partner. And the reason for that is I'm already retired from 32 years of federal government. I'm not going to be on this planet forever. So I would love to find someone a little younger than me. That would be ideal, that they could take it to the next level and they could carry it on at a point when I'm ready to stop. Because I've had actually offers for people to buy my business out of state. I don't want to send my equipment out of state. I want to keep it here. I brought it here for a reason. I want it to stay here. And there's a lot of interest in it. There's a lot of people that want to do it. And I need that help. I think for what I want to do, I really want to find a business partner. I can use interns and things like that in the meantime, but I really would like to find a business partner.
You may want to market more to like graduating people who will be younger and.
That's true. In fact, I would love to get into the 40 under 40 just to come and be a presenter. Obviously, I don't fit into that demographic, but I'd love to come and talk to them and find somebody that would be interested in doing that with me.
Have you done anything, when you're talking about the doctor's offices? My doctor, I'm able to get like sonic or ultrasounds in their office because there's a mobile unit that comes to their office. So they actually are the ones that are billing me, and I'm paying my copay there, and then they're paying the person that's coming.
Yeah, that is very complicated to do. I do go into doctor's offices, but I go in as an independent contractor because it's just so complicated with the state, and especially if you go to more than one office. Sonogram companies are already set up to be an enterprise that does that and works, the medical community and the insurance companies, they're all familiar with that. So anyways, I would love to do it like that. Like I said, I do go into offices and do them, but I always do it as an independent contractor.
Do you have brochures or pamphlets that you're distributing in the OBGYN clinics, or how about the doctors that are doing the diagnostic readings? I would think one of them maybe, or someone that's involved with Duke might be a good resource.
Yeah, those of course are out of the area, but I do have brochures in the different doctors' offices in different places. I do, yeah.
Do you advertise any places?
Yeah, yeah, I advertise in Women's Bee magazine and also the Newcomers magazines. And interestingly enough, there's a DO at Fort Bragg. She refers to me all the time. I've never met her. And I really need to go and just have lunch with her sometime and talk with her because she has really sent me a lot of clients, So
What's her name?
I don't know. I don't remember. So I have it on the paperwork, but
I think what you probably be looking to help you would be somebody already in the medical field, maybe a doctor that wants to invest in your company. I don't know. People in school we don't have that kind of money.
well, that's true.
But I don't know.
It's not the school, not to knock the doctors, but I would not look for a doctor as a business partner. God bless them. They do their fields great, but they're not the best business people.
Well,
You need a business,
just the money.
person.
I was going to say, I can tell you from experience, there's a lot of issues with the back office. It's not really the doctors. The doctors do their thing and they do it well. It's the back office. That's where the issues are. But there might be some situations.
Right, well, if the doctors were better business people, they'd have better back offices. That's the point I'm getting.
Yeah,
But
that's true.
to the technical aspect of what you do there, this is not an x-ray.
No, and no radiation, no pain, no touch, no contact.
And the people that read to me, looking at the inflammation readings up there, they all look the same to me. So,
Well, that's, because you haven't been trained.
right. So if they see something that looks inflammatory, they can tell that it's going to be precancerous cells or arthritis or
Yes.
there's no inflammation in your joints, that kind of thing?
They can tell. And different things, a lot of times people think that the hot areas are the, quote, bad areas. Well, they are for certain things. But it might be that a cold area is also a bad thing. And I'll give you an example. This is, and I find this fascinating, but this area here, if you can see that right there, where it's blue, it's cold. The coldest color, by the way, is black, and the hottest color is white, just to kind of give you the, the range of colors here. So this blue area shows, you can see it's not the same as the rest of the shoulders or the neck. And this shows autoimmune disorder. How fascinating is that? How many things show autoimmune disorder?
None
So
that I
if you
know
have
of.
Hashimoto's, or you have thyroid issues, then you know that there's a autoimmune disorder attached with that. You're going to treat it. A doctor will treat it differently than they would treat just someone with low functioning thyroid. So and this can also be monitored over time to see if the protocol is working. So anyway, that just shows, and then here this is dysfunctional RSD, which is, I'm not a doctor, so anyway, it's kind of obvious that these two are different. And that's under functioning, there's really no blood supply going on in there, there's no circulation whatsoever. So, and then this is a colder area too. You can see that that's a tumor. So again, they were watching that. I believe it was, I'm not sure exactly where it was or what type it was. So.
Does it pick up on clogged arteries and potential aneurysms?
Yes, not aneurysm, but the clogged arteries it does. It just looks like a Christmas tree in your neck if you have a blocked carotid artery. Yeah. Excuse me.
I'm a client of Jill's, so I've had a full body thermogram, and both my physicians were glad to get that extra information. And for me, I wanted it as a tool, and I just did it recently in the last 6 months. So, because I don't want to rely just on the medical world, because they're set in their ways sometimes. But my one physician, backs up doing this. And so it was good for me to get a baseline. And what happened when the report came back, you get a very thorough report, and you get that, which doesn't do much for me because I don't know how to read it either, but the report confirmed what we already know. So that was good because, same thing, I have changed my dietary regime.
Right.
And then eventually we'll see, if that's making an impact on that, on what it is. And I just think it was a really good thing to do. I think that maybe for your partner, you need someone that has the background like you did, came into it because of your mom and all that kind of thing, and would be able to have that passion that this is, because it's a new thing, and as you say, we're always behind in this part of the country, and it takes a while for people to get it going. So, not that it's your job to do it, but I would suggest also going and talking to maybe the physician assistant program at Methodist, maybe at Campbell. Don't they have the?
I used to actually teach the nursing students out at
or in the nursing program too,
Right,
because
yeah.
they're the ones that are going to carry it forward and
Right.
say, maybe we should do a thermogram or blah, blah, blah.
Right.
Because you're like a pioneer. It hasn't been around that long. A lot of people don't know about it.
In fact, an interesting thing, I had one of the nursing students that I used to teach the class up there, and she was in the class about 2 years ago.
Mm.
And she called me up and about 6 months ago, and she said, yeah, I'm now working in a doctor's office, and the thermogram came through, and the doctor said, I have no idea what this is. And she said, I know what it is.
Yeah.
So you're right, it is, it's, again, my issue is, time and,
Right,
getting
that's what I'm
someone
saying.
else.
It's pretty
Yeah.
hard to do that.
Right.
But my general doctor, that was helpful for him to see on my record, that's something that we're going to pay attention to,
Right.
as you age and blah, blah, blah.
Yeah. And this is phlebitis, but this is what the neck area looks like when you have blocked carotid artery. I mean, it really lights up like a Christmas tree. So just to kind of give you an idea. And I'll tell you another really good use for it is mysterious pain. I had a guy come in, he said, I have pain in my elbow. And he went to his doctor, they did all the normal stuff, they did the steroids, they did physical therapy, they did x-rays, and then they did the pain medicine. So after a year, he said, well, I still have pain in my elbow, can we figure out what it is? And he said, it's all in your head. Took away the pain pills. His wife bought him a full-body thermal imaging thing. He came in, and he asked me, well, do you see anything in the elbow? And I said, well, I'm just the thermographer, so you'll have to wait till the report comes back. So the report came back, and he called me up and he says, well, I guess it's all in my head, there's nothing there. So I went and looked at the image in the report, and I said, well, there's nothing in your elbow, but you have a pinched nerve in your neck is what it says. You know, sometimes pain is referred. You feel it one place, but it's not really there. So I said, do you have a good chiropractor? He said, yeah. I said, well, take it to him. And so he called me back 2 weeks later. He had taken the image to the chiropractor. The chiropractor adjusted that area in the neck, and after about 3 or 4 weeks, it was gone. So,
You need to include a few more of those case studies like Pam and what you just said in that presentation.
Yeah.
3 or
Okay.
4 of them like that would be.
Well, I'll tell you the best one of all is I was at Fayetteville Hyperbarics doing an educational thing. And this lady started running, yelling, you saved my life, you saved my life. And so I got to move out of the way, and I'm looking to see who she was talking about. And she ran up to me and hugged me. And I said, what are you talking about? So when we did the thermal imaging, it was kind of funny because I asked her, and I do ask questions when I'm going through this because I do see things, but I can't give a medical opinion. So I said, do you have any sinus issues? She said, no. I said, okay. Her face was just as red as could be. And then I said, well, what about dental issues? You know, looks like you might have something going on up here. She said, no, and I've spent a lot of money on my dental stuff, so, you know, I shouldn't have anything like that. I said, okay. So when the image came back, she took it to, or the report came back, she took it to her medical doctor, and he freaked out. He looked at it and he said, well, you know, according to this report, you something's penetrated your sinus cavity, and that's where you had your dental implant a year ago. He said, you can have a dental implant penetrate the sinus cavity, it will kill you within 2 years, and there's no symptoms. So this was a year after she had had that. And so then she went through hyperbaric oxygen therapy, she did antibiotics, 5 or 6 different protocols over the next 6 months. And of course she had the tooth taken out and replaced. I think it was replaced later on, or I don't know what she did about the tooth. But anyway, she recovered from that, and then she came back after 6 months and she did the imaging just on the face to see how that looked, and everything was better. Wasn't completely cleared up. They did a few more protocols. It took 9 months for all of that to go away. So think about the timeline. The doctor said it would have killed her within 2 years. So that was really one of the most interesting cases that I had. The one issue I do have is I can't say, oh, well, she had a thermogram. You know, can you tell us about it? I can't do that because of medical, you know, privacy. But it does help when people volunteer that information. And that story, like I said, really, you know, touched my heart.
You gave us an idea of your cost. You know, like you bring my wife, you do the thing, you do the imaging. Then you send it off to somebody, correct?
Right.
Okay. What do the doctors on the average charge? So I have a total idea of what you charge and the doctor charges.
It's included in the price.
Thank you.
It's included in my price to you.
That helps me because
Yeah.
I did not know either way.
Yeah. Yeah, okay.
You do breasts, but you also do whole body.
Right.
Is it the same price?
No.
Okay.
One area is $170. So, you know, when you've seen, some people just come in and do the neck study. Or, you know, they have a bad elbow, they might do like an upper body. So the full body is $470, and that includes everything. There is a neck study you can do knees, you can do elbows, you can do shoulders, but you're also doing the full body. So you can do feet, hands, the whole 9 yards.
So let's say you're doing the neck. Where will you start? Where will you do the image? Just from here to here?
Yeah, if you're doing the neck, you're going to do from about here to, you do like a wider, further away image that will take care of this. and then you kind of zoom into this area, and there's 6 images altogether. So there's one from, you know, this area, and then there's 6, one facing forward, and then you do the right and the left, and then you do a 45 degree on each side. So one of the things too is symmetry they look for. So a lot of times people come in and say, well, I want to get my right ankle image. You have to do both, because they want to look at both sides and see what's going on. Your body, you know, fights for homeostasis. It fights to stay in alignment, that everything's the same on both sides, or relatively the same.
Would this also show the brain?
It does not. The limitations are it won't show anything from this area to the bottom of the skull cap. And also the groin, lower groin area, it won't show it there because there's just too much heat and moisture there. So it's not really a good thing for prostate cancer unless it has radiated up above the pelvis. Everything above the pelvis can be seen. So
What about the spine?
Oh yes, absolutely. In fact, I never knew there were so many people that had scoliosis. I would sit there, you know, I remember when I was first doing it, and I would say, are you standing straight? You know, check my cameras and stuff. Oh, okay, it's just the way their spine looks. Because, you know, you can't really see it through the skin. I guess you could if you were really studying it and you were a back doctor or a chiropractor. But, you know, I'd look on the camera and go, wow. I mean, some of them are just very interesting.
Jill, I'll take the last question. How can someone get in contact with you if they want to refer a business partner, maybe the intern that this lady suggested?
Sure, my cards are over here, and I have some brochures. I would love people to take those and share those, of course, and I would love to find a, you know, a partner, a business partner. If you know of somebody, please let me know.
Do you know my question? Do you mind email us a copy of your PowerPoint presentation, or?
I could, if you wanted to email me.
Okay.
Sure. Mm-hmm.
And along with helping you find a business partner, what else could the community do for you?
Well, of course, send me clients.
Where are you located?
I am at 1404 Rayford Road at Breathing Space. And I used to do a lot of where I went up to Harnett County, Moore County, even Charlotte, Wilmington and stuff, but I found that I just don't have enough time to do all of that. And I only have one camera, so I can't be doing imaging here and send out somebody there. I really need to get a partner in to, you know, have that work as well, and then we can, you know, hire some people and they can go out into the communities as well. Because that is one of the things that I want to do, is do that again, go out to different places. Mm-hmm.
You just gave me the street address. I can't see it.
Okay.
Is it near Harris Teeter?
Yeah.
Is it
If you're Harris Teeter's, it's in Haymont Park. So if Harris Teeter's on your left and Apple Crate's on your right,
correct.
then you're heading towards downtown. All the lanes come down to 2 lanes.
Mm-hmm.
There's Holy Trinity Episcopal Church on the right, and then it's about a half mile up on your left. It's the very last house, and it's been turned into a business. They do yoga and all kinds of neat stuff there.
Thank you.
Mm-hmm. You're welcome.
Thank you so much, Jill.